Fentanyl overdoses are now leading cause of death for Americans aged 18 to 49. That's according to a new analysis by the Washington Post amid the deadliest drug epidemic in American history. More than 100,000 Americans died from drug overdoses last year, with 2/3 of those deaths tied to fentanyl. The same death toll is expected this year. That averages to nearly 200 people dying every single day from fentanyl, a powerful synthetic opioid that is cheap to produce. The painkiller was developed 60 years ago to treat intense pain from ailments like cancer. It is 50 times more potent than heroin. Even a small dose can be fatal. Joining us now, the president and CEO of the Hazelden and Betty Ford Foundation, Dr. Joseph Lee. Dr. Lee, thank you for being on this morning. Explain how we got here. How is fentanyl so deadly and such a small amount? How is it being ingested? How is it being abused? How did we get to the point where, at this point, it's one of the worst leading causes of drug overdose deaths?
Well, that's a great question. And to catch up the audience, we're in the third phase of the opioid epidemic. Over a decade ago, everybody heard about oxycodone and pain medications being overprescribed in doctors' offices, and that's how this mess started. And in the second phase, that evolved into the demand and the use of heroin. But then what happened is the black market got very competitive, and fentanyl came into the mix. Fentanyl is a synthetic opioid, cheaper to manufacture, easier to hide, harder to detect. So it became popular in the black market as a substitute for the real thing, so to speak. And small quantities go a long way. And so in that way, it's very potent. And so a lot of people started to die accidentally. They didn't know that what they were taking had fentanyl in it, or they thought they were taking another pain medication. And that's why we see the tragedy we see before you in the news.
So those who are finding that fentanyl is lacing whatever it is they're taking, what drugs, what are people taking when they don't know that fentanyl is actually in there and it kills them?
Well, the way the black market works, and I know this being an addiction medicine doctor working in the front line with young people who have been very entrepreneurial over the years. I saw this happen over the past decade. You see people who are dealing drugs and organizations that are dealing drugs cut things into substances to maximize profit. And they want to cut something into it that has a pop to it. And so fentanyl certainly does. And so they'll cut fentanyl into opioid medication, and then they started cutting it into other medication or other drugs that people take, like Xanax and sedatives. And so it turned out that I saw a lot of young people who didn't even know they were taking fentanyl. They thought they were taking Xanax or some kind of sedative. Right. And then when we did the urine drug screen, it turned out they were taking fentanyl. And then some of them across the country passed away.
That is incredible. So what are some of the things that the government can do to help, and what are some of the ideas to try and push back against this epidemic, especially given how challenging it is? It is much easier to produce and get around, given how small an amount can cause such a big effect.
Yeah, to really tackle this problem, it's a complicated problem. You need to deal with both the supply and the demand. And that's what the current drugs are, Dr. Rahul Gupta says, and I agree with him. On the supply side, it can't be doubling down on tactics that haven't worked, like over-incarcerating, over-prosecuting people. There are smarter supply-side tactics, like freezing assets of people who use Bitcoin to work with labs to bring drugs into the country. And you have to work on the demand side. You need more treatment. You need medications for opioid overdose reversal, like naloxone. And you need medications to help with treatment and better access to treatment, recovery, housing. But you need more than just government policy. You need a way to incentivize mainstream health care. Throughout the opioid epidemic, I think mainstream hospitals and big health organizations, they want to help with the opioid epidemic, but they have a problem. Number one, they don't know a lot about addiction. And number two, the financial math in building services for addiction and other behavioral health, it just doesn't work for them. And so they don't know how to do it, and they don't have the financial incentives to do it. So as a country, you're seeing a lot of the addiction treatment happening on the fringes and not in the mainstream, and that's a problem.
Dr. Lee, as you know, this is terrifying for parents across the country because there's so much of this stuff circulating out there, and you touched on it, but there have been all these stories about a kid takes a Xanax, thinks it's a Xanax, but they ordered it online somewhere, not through their pharmacy. They didn't get it from a parent, and they die because there's fentanyl in it, let alone people who try, young people trying recreational drugs maybe for the first time, and there's fentanyl in it, and they die, they overdose. So what would you say to parents about keeping an eye on this stuff, monitoring, checking in with your children so that we can at least start at home by stopping some of this?
Yeah, you know, the education and prevention efforts, I'd ask for parents to really advocate for their school systems to invest in prevention efforts. It's not a cure-all, but it helps. You really can't mess around with fentanyl. You know, back in the days when people were drinking alcohol and using other substances, you'd get a second round and a third round. But with fentanyl, it's so potent and deadly that people don't get a second chance. A lot of people who are naive, don't know anything about opioids, end up overdosing. People who are really experienced and who think they know what they're doing end up overdosing. And we've seen this at celebrity levels and people who are high profile and young people as well. And so parents need to up the game in advocating for prevention, education, and really strong ties to relationship building and communication with their young people.
All right, President and CEO of the Hazelden Betty Ford Foundation, Dr. Joseph Lee, thank you very much for being on this morning. We appreciate it.